Hello everyone, welcome to Lab Explains. First of all, I want to thank all of you who have already subscribed to my channel, Lab Explains. We hope to have exciting episodes of medical laboratory investigations explained right here on Lab Explains. Today, however, I want to take a brief look at a commonly requested medical laboratory investigation, a test which is often self-requested. So an individual says, for example, I want to check my blood level. What we've actually found out is that that individual actually wants to know his or her hemoglobin concentration. And this is rightfully so because if you take the whole blood, it contains three main cells: the red blood cells, the white cells, and the platelets. And of course, the most predominant of all these cells are the red blood cells. And you see, what is responsible for that oxygen carrying capacity of the blood? It is the hemoglobin, which is an iron-rich protein molecule found in the red blood cells. It has two main functions. First of all, to transport the oxygen from the lungs to the body tissues. After the body tissues use this oxygen, they produce carbon dioxide. This carbon dioxide is again bound to the hemoglobin and brought back to the lungs to be expelled out of the body when you breathe. And in this process, there's what we call the ion oxygen formation, which is a molecule that gives the red blood cell its color. And of course, your blood is red because of this ion oxygen rich molecules. Yes. So you see why your red blood cells and your whole blood is red? Because of this ion oxygen molecule. But how do you get your blood tested? First of all, we need to obtain your blood through number one, either you can have a sharp prick of your finger, preferably the ring finger. So the phlebotomist or the person who takes the blood will do a cleaning of your ring finger and use a sterile lancet to make a prick, and then a drop of blood is obtained for that test. The results can be obtained within few minutes. And if you want to have this HB, which is of course commonly measured as a part of what we call the full blood count, then your venous sample needs to be taken. And I'm sure you've had your blood taken at the laboratory before from the antecubital fossa. So a vein is located there and all the procedures, clean procedures, are put in place so that your blood is taken cleanly by a trained phlebotomist. Now, about 2 mils or 2.5 mils is obtained for this procedure. After that, the place is cleaned nicely and the blood is stopped, and then a circular plaster, is applied to the point. Within a few minutes or hours, the place should be healed completely. Of course, the blood stops just after the sample is taken because dry cotton is applied to stop the blood from flowing. After that, a plaster is applied. So don't worry. You don't need any special precautions before you come and do a full blood count test. You can just walk into the laboratory and have it done. You don't need to fast. However, if you're on any medication, you can let your doctor or your laboratorian know about it. Now, how do you know that the HB that I'm going to have tested or I have done testing is normal, is low, or is high? Of course, that means you need to have a reference range. And this reference range is determined based on your age, your gender, your geographic location, your diet, and other conditions are put into consideration. However, for the sake of this discussion, we want to work with these reference ranges. Adult males 12.5 to 17.5, adult female 11.5 to 15.5, a child 1 year to puberty 11 to 13.5, baby 3 months old thereabout 9.5 to 12.5, and a newborn 15.0 to 21.0. So if your HB falls below any of this, then it is called anemia, low HB. What are the common signs and symptoms? Of course, yes, the signs you're going to mention, the symptoms you're going to mention are not specific to anemia. Other conditions can present, but mainly the common symptoms are pallor, where the skin and mucous membrane appear lighter than they usually would look. There is easy tiredness and lethargy. There is shortness of breath when you do a little work. There is dizziness and sometimes fainting, headaches, constipation. And some advanced signs could be increased pulse rates, palpitations, and tachycardia. But what causes your HB to be low? Sometimes it can be due to acute blood loss. That is some instant thing that happens, for example, an accident. Sometimes some emergency surgeries can cause your blood to be lost acutely. There is also what we call chronic blood loss, where there is intestinal bleeding or gastrointestinal bleeding, increased menstrual flow in women. Other causes of anemia can be iron deficiency, vitamin B12 deficiency, or folic acid deficiency. Some cancers can also give rise to low HB. Some chronic conditions, which are called inflammatory chronic diseases, such as rheumatoid arthritis, can also give rise to low HB. Chronic infections such as tuberculosis and HIV, hematological problems, cancers such as leukemias, some endocrine or hormonal related diseases such as hypothyroidism can also give rise to this. Then inherited defects in the hemoglobin structure such as sickle cell anemia can also give rise to low hemoglobin. And then some inherited defects in the structure of the red blood cells such as glucose 6-phosphate dehydrogenase or G6PD deficiency. At times too, your hemoglobin can be very high and it is called polycythemia. Of course, the main undesirable effect of polycythemia can be blood clot formation in your system. And how do you know it is very high? Sometimes there is dizziness, there is easy bruisability and bleeding, and sometimes excessive sweating. The common causes of high hemoglobin concentration is congenital heart disease. It can also be due to liver or kidney cancers, chronic lung diseases, smoking, dehydration, exposure to carbon monoxide dehydration, and when you live at high altitudes. And what are the interventions when you have anemia? We said that anemia needs to be investigated so that we know the cause so it can be properly treated. So is it that you lack iron, you lack vitamin B12, you lack folic acid, or any other thing? The full blood count can give a picture of all of this. Then sometimes differential tests are ordered to be able to actually pinpoint the cause so that it can be properly treated. Once the cause is obtained, the clinician, the physician can give you medications in form of hematinics or sometimes tablets to be able to take so that the condition will be corrected or managed properly. So in a brief, we've been able to look at the meaning of hemoglobin concentration, why it is important, what happens when a person's HB is low, when it is high, and when it is low, what are the causes? What interventions can be put in place? Please, I hope we've been educated, and we hope to have our next episode discussing a full blood count so that we see the various components of the full blood count and how they all intertwine to be able to make a meaningful interpretation of your blood situation. Thank you for listening, and remember to subscribe. Our next episode will be in a week's time. Thank you all very much. Lab Explains, here to stay, here to help all of us understand the medical laboratory investigations in simple terms to the advantage of our health and all of those people who manage our health conditions. See you later. Lab Explains, here to stay.